left ventricular hypertrophy tends to happen in people who have high blood pressure, long-standing high blood pressure for that matter. But remember, high blood pressure usually is diagnosed. It is not discovered. Welcome to your daily health briefing. I'm Dr. Albert Thicken. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. Left ventricular hypertrophy is the heart damage no one is talking about. That is why we are going to talk about that today. Let me tell you a story of my patient, Samson. He comes in to see me as a new patient and happens to have high blood pressure. So as always, we schedule him to get an echocardiogram to evaluate the left side of his heart to make sure that he does not have left ventricular hypertrophy. And you ask me, Doc, what is that? And I'm glad you asked. Left ventricular hypertrophy is a thickening of the muscle of the left side of the heart. Why is that important? It's important because left ventricular hypertrophy tends to happen in people who have high blood pressure, long-standing high blood pressure for that matter. But remember, high blood pressure usually is diagnosed. It is not discovered. Because most of the time, people have had high blood pressure for a while. They just did not have contact with a healthcare provider to document that. And so consequently, when high blood pressure is diagnosed, we tend to do an echocardiogram. Or if you've had long-standing high blood pressure, we do an echocardiogram as well to look for left ventricular hypertrophy. But why does left ventricular hypertrophy happen anyways? It happens because high blood pressure causes an increase in resistance in the arteries that receive blood being pumped by the left side of your heart. Let me give you a simple analogy so you can understand it. If you grab a dumbbell and you do 20 reps every day with this dumbbell, guess what's going to happen? Your bicep is going to get bigger. Why? Because it needs to build more muscle to continue doing that activity. Same goes for the heart. If you have high blood pressure and your left ventricle is exposed to that high blood pressure over time, guess what happens? It develops something called hypertrophy, meaning the muscle becomes bigger, like your bicep with the dumbbell. So high blood pressure now functions as the dumbbell that your left ventricle is using to exercise. Now, if you are a person using dumbbells, you will look good. But if it's your heart does not look good. Your heart does not like it. Because with left ventricular hypertrophy, eventually comes many problems. And this is where we delve into the science. Left ventricular hypertrophy has been shown to be an independent risk factor for mortality, all-cause mortality. And I know you're wondering what that means. It means that left ventricular hypertrophy is just a cause of death. And the Framingham study showed that for every increase in left ventricular mass, there is a proportional increase in risk of death. So, left ventricular hypertrophy has been shown to cause heart failure. It causes strokes, it causes heart disease, and it causes all-cause mortality. That is, dying from all causes. And so this is a disease, a problem that is not appropriately addressed in medical care today. That is why cardiologists insist on patients getting echocardiograms when they have high blood pressure. Now, I also understand that patients are facing many obstacles in getting appropriate care. Our care in America is very fragmented. A patient goes to the primary care doctor. He has high blood pressure. Now he needs an echocardiogram. What happens? You give him a referral to a cardiologist. He calls the cardiologist. They don't accept my insurance. He calls back the office. Can you give me another referral? He gives another one. Call another cardiologist. We don't accept your insurance. Patient gives up. Or if they accept his insurance, guess what? You cannot be seen for another 3 months. The patient waits for a call confirming the appointment. Nobody calls back. He forgets about it. The doctor doesn't bring it up at the next visit. Patient forgets about it. Cardiologist never calls the patient. It never gets done. That is a world of medicine patients have to navigate. It is a very fragmented system. But it shouldn't be so. We doctors, especially we primary care doctors, have to insist that the patient gets the test, because you can find out if a patient has left ventricular hypertrophy, and then all of a sudden you have to intensify their blood pressure treatment, right? If somebody was coasting along with a blood pressure of 135/85, now you know that this is a person whose blood pressure needs to be brought down to 120/80 or less, as recommended by the most recent guidelines from the American Heart Association and the American College of Cardiology. It helps us make strategic decisions for the patient's care. So we doctors have to insist that the patient gets the appropriate test. And we also have to create the infrastructure for the patient to get the test and the necessary follow-ups for the test results to be addressed. That is how primary care and cardiology can work in synchrony to help the patient. So, if you take anything from this episode today, if you have high blood pressure, make sure you ask your doctor for an echocardiogram to assess whether you have left ventricular hypertrophy or not. If not, your blood pressure will turn the left side of your heart into a bodybuilder. And you know what happens with bodybuilders? They eventually get tired. And when that happens to your heart, you wind up with heart failure or death. So you want to make sure that that is addressed. And remember, the good news is that we can catch this before it happens. We can catch it after it has happened, and we can remedy the situation. Okay? All right. I hope you enjoyed this episode today. If you know someone who has high blood pressure, ask them if they've had an echocardiogram. If you have high blood pressure, make sure you get your echocardiogram. I will see you next episode, because remember, the fight is. This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Thicken, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.